My name is Genzel, and this is a little spontaneous for me, but I could probably do it.
You have about 6 minutes.
Okay, thank you. So, my name is Genzel. I am 73. I've been on disability for most of my life as a result of a head injury and trauma. I've lived here 28 years. And I've had several head injuries. I am on the Mind Source board, so I know Summer from that. And I have an undergraduate degree in public administration, and I have a master's in business and a master's in library science. But I've been disabled most of my life. So I have a lot of experience dealing with the system and then falling through the cracks of the system and kind of critiquing the cracks as I fall through them and trying to somehow grasp at things and keep myself together. So I was wanting to get you earlier. Someone named Tim Schaff spoke earlier, and he and I have worked on a group for adults that had pediatric injuries. And I just was speaking to him, and I was trying to see what he said that I could follow up on. So I have to kind of collect my thoughts, because he did tell me some of what he said. There's a few other things I might as well throw in while I'm here. I have tried to come up with a variety of suggestions for ways to improve the healthcare system. I had a head injury when I was 4. I had one 20 years ago, and I went through the flood in Boulder 6 years ago. So I've been dealing with a lot of trauma from childhood and recently. But I try to kind of distract myself by running around with ideas, and I'm somewhat creative. And so I've tried to make a lot of suggestions to people. So I'll just throw these in. I came up with a walking program that I started at CU a number of years ago that I think would have a major impact on mental health. I want to have like regular walks, same time, same place every day, led by volunteers, because we have a healthcare crisis. There's obesity and depression, which both have to do with lack of exercise and lack of community. So that's one thought I had about how to create community by creating regular walks. Everybody knows about walks, but I want to do it in a regular way. So there's a kind of focal point for people. I have another idea about getting paraprofessional case managers trained to supplement the lack of case management in healthcare and in social services. And I have a third idea to try to improve the caliber of non-medical care where there's a great shortage. I want to get undergraduate students to be willing to work for non-medical care agencies and kind of make them feel that they're part of a team, a healthcare team, where they can report back to doctors about patients and help patients comply with doctors' orders, which I think will be beneficial. Which leads me to another issue, which is that one of the problems that I've had is a lack of support. So I have Medicare, I don't have Medicaid. I haven't wanted Medicaid because you have to be indigent. There's a crack in the system where if you're over 65, I'm 73, you can't get Medicaid without being indigent. So that's something that I think needs to be addressed because if I get Medicaid, I have to be indigent, and I don't trust the system. I've dealt with it for too many years to be completely at the mercy of it. So there's one thing that I think needs to be addressed. But one of the problems is Medicare doesn't cover case management, and I've needed case management. So people need case management. And they also need a support person. So you have to be able to ask each person whether they have a support person. And an inexpensive way of getting that would be a better caliber of non-medical care through agencies, because that would cost $12, $15, $18 an hour, and you could improve people's compliance and give them more resilience, because it's difficult to navigate the system, and everyone needs someone who is more resilient than they are. And I have not had that, and I've had great difficulty, especially after the flood. I also am somewhat of an expert on being disabled, dealing with a natural disaster. And I've tried to have some input into the state and Congressman's office and Senator's office and whatever about being disabled, dealing with a natural disaster. So those are some other things that I have an interest in. I would be happy to confer with anybody who wants to talk to me. I don't have a lot of energy to work my way through the system and deal with bureaucracy. If I can talk to people who make policy, I might actually have something to say, and I'd be glad to do that. I spoke to the Lieutenant Governor yesterday, and I'm trying to have an impact, but I'm also very impacted myself by my own difficulties and going through a flood, etc. Now, getting back to what Tim was saying this morning, one very specific recommendation, well, one regarding head injury, and I've discussed this with Summer at the Mindsource thing, is I'd like to see a public service campaign to raise the issue of head injuries to the public, to make people aware that, like, why is Daddy drinking himself to death? Well, maybe it's when he fell off that horse, he started drinking. So I think people need to be aware that head injuries can have long-term consequences. And through the Mindsource group, we're trying to maybe create a campaign like that and then direct people to resources around brain injury. Because I have a head injury and trauma from childhood, and those things can turn into coping mechanisms which either are specific mental health diagnoses or mirror them to such a degree that it's indecipherable. I think that we need a lot more awareness, especially around pediatric injuries, because they affect development, which I think Tim addressed. That, according to the article, which I think you have, Jeannie Dice-Lewis and Lisa Brenner, they say that if you have a pediatric injury, which is up to age 25, all of your subsequent stages of social and emotional development are impacted. So you don't have a foundation to become more socialized. And in terms of the criminal justice system and
about 30 seconds.
And the general public, yeah, I have 1 or 2 more points. I would see a formulation where people who are incarcerated could be asked if they had pediatric injuries, and if they did, just tell them that, well, you had a brain injury, you have neurological damage, that affected your social and emotional development, and then you probably use drugs and alcohol to try to correct that, and that led you to more maladaptive behavior, and then you did stupid things, and that's why you're in prison. So you may be an injured person, and maybe that would give you another perspective of your life. The last point that I want to make, the conclusion I came to from all of this, is I have a head injury from childhood, which affected my development. It affected my social and emotional development, but not my intellectual development. If I had intellectual developmental delays, I would be eligible for much more services through things like Denver Option. I have needed that kind of support, and I think there needs to be a merging of the services for people with developmental disabilities and people with mental illness if they have had a head injury. So if they had a pediatric injury and they had social and emotional developmental delays, not intellectual, they need the kind of support that people that have other developmental delays get, and that would be a much more effective way of treating the underlying maladaptation and getting them to be more whole and functional. So, hope that makes sense. That's